And welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us again today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. We've seen more improvement in our local situation over the past week. Our cases continue to drop in the community overall and in schools and the university. The positivity rate further declined, and these are all good signs. And we're on the right track. It's been a collective effort to help our community get through this surge, to help our hospitals preserve capacity, to help our schools keep classrooms open, and to help limit disruptions to our local businesses, and to help protect one another. So many people are taking action, and I want to say thank you. Your actions are making a positive impact, and we're closer to getting our community to a better place. Unfortunately, much of the data is still higher than before the surge and in the red, including hospitalizations. For this reason, the COVID-19 risk dial remains in the red this week. I'd like us to take a look at our local situation. Last week, we shared that our cases had peaked. On this chart, we can see cases going up for 3 straight weeks, peaking near 5,000 cases a week for the week ending January 15. Then we see the number of weekly cases going down over the next 3 weeks. We had 1,437 cases last week, the lowest weekly totals this year. This 3-week decline represents a drop in the cases of more than 70%. Our case rate is still higher than it was in December before cases started increasing, but we are hopeful this downward trend will continue. More good news. We're seeing our positivity rate drop further as well. This past week, we ended at 15.9%. This is the lowest rate for our community since the week ending on December 25th, when it was 11.9%. We would like to see the positivity rate drop below 10% to show lower transmission of the virus in the community. With some data showing significant improvement, our main concern continues to be the COVID-19 hospitalizations and deaths. Hospitalizations increased to an average of 137 people per day for the week ending February 5th. And you can see this on the right side of the chart. We experienced very high numbers of hospitalizations early last week. On Tuesday, February 1st, 147 patients were reported hospitalized, which included the most ever for Lancaster County residents at 113. By the end of the week on Saturday, February 5th, 122 COVID patients were hospitalized locally. Today, the hospitals report 130 COVID patients, with 99 from Lancaster County. The patient count is still high and our hospitals are still strained. There are no deaths to report today, but we've lost 8 members of our community to COVID so far in February. To help ease strain on the local hospitals, the Nebraska Department of Health and Human Services opened the first site of hospital decompression program here in Lincoln. The program helps relieve some of the pressure on local hospitals by providing a facility for patients who no longer require acute care, but still require skilled nursing care. We have guests from our local hospitals here today who will share more information on this program and its impact so far. We've been closely monitoring other parts of the country that peaked before us, and if we follow a similar trajectory with lower cases, we anticipate hospitalizations will also decrease and we can move out of the red and into a lower risk category. With the dial staying red this week and our COVID-19 hospitalizations remaining high, we will be extending the DHM and the mask requirement for 2 weeks through February 25th. We're all anxious to put this surge behind us, but right now, our hospitals still need our help to relieve some of the strain they continue to experience. And it's important not to remove preventative measures too soon, only to lose the ground we've gained. Our goal is to have the directed health measure, not to have the directed health measure any longer than we absolutely need to. We know masks are a helpful tool to help slow the spread of the virus. A recent study released on February 4th showed that people who reported wearing a mask indoors were less likely to test positive for COVID-19. As you can see on this slide, the level of protection increases with the type of mask used. As I mentioned, we have guests from our local hospitals joining us today to provide an update on their current situation. Dr. Mike Rapp is the Vice President of Medical Operations for CHI St. Elizabeth, and John Woodrich is the President and CEO of Bryan Medical Center and Executive Vice President of Bryan Health. We'll start with Dr. Rapp and then turn it over to John. Dr. Rapp?
Thank you, Director Lopez. As we go into the third year of the COVID-19 pandemic, it's hard to believe we're still here. Case numbers remain high. Staff continue to be stretched, and patients are still getting critically ill. For many who don't work in healthcare, the pandemic may not feel like it did at the beginning. It may not affect your life the same way. But for the nurses, doctors, and care teams who continue to show up to work every day emotionally exhausted, the pandemic is still very much going on. The Omicron surge has been incredibly tough on our healthcare teams. The record number of cases into the community translated to high patient numbers in our hospitals. And while it appears the numbers show we may have passed the peak and are on the way down on the surge, the hospital admissions will reflect the level 2 weeks prior. We are still seeing very sick patients who are still needing critical care, especially those who are not vaccinated. Right now at CHI Health St. Elizabeth, we are taking care of 24 COVID-19 patients. Across the CHI Health system, we are caring for 199 total COVID-19 patients in 14 hospitals. 41 staff have been exposed and 26 are quarantined. The numbers have remained at least this level or higher now for several weeks. We are hopeful the numbers will continue to decline, but it depends on you. We need the community's help. It's as simple as wearing a mask when you're out in public or at work. Masks have been a vital tool in keeping COVID-19 transmission down throughout the pandemic. Masks help us protect our staff and our patients. We ask the community to mask up to protect their neighbors, their loved ones, and even complete strangers. In addition to masking, we urge everyone who hasn't been vaccinated to consider doing so. If you've been vaccinated, please get your booster. It is extremely rare to have a patient with a booster be in our intensive care unit. Wash your hands, social distance, and stay home when you're sick. If you're tired of hearing these things, imagine how tired the healthcare workers are. We can make a difference if we work together. Mask up and help save lives. Thank you.
Good afternoon. Thanks, Dr. Rapp, for your comments. So at Bryan, we're optimistically cautious. Today at midnight, we had 540 patients in-house. We actually have been able to convert one of our COVID units back to a regular unit, so that's a good sign. But we still have 84 COVID patients that we're caring for. 54 of those individuals are positive. 30 of those individuals are no longer positive, but they're still needing care and are very ill patients. We're glad that the numbers are coming down, and we hope that that will continue in the next few weeks. One of the things that we would love to do is start to loosen our visitation policy as well, so more family members can see their loved ones. But we also have a number of surgeries in this community that have been postponed for a long period of time, and we know there's a number of people that need those surgeries as well, and that's why we're asking for your help. You know, our staff have been very resilient during this, but I think you guys all know they're awfully tired. This has been going on for a long period of time, and they've seen a lot of sadness over the last few years. We've cared for over 3,100 hospitalized COVID patients. Unfortunately, 461 of those individuals have died. You know, we've seen 174 deaths since August the 1st of 2021 at our facility. But of those 461 in total, 57 were in some stage of their vaccination, but all the rest were unvaccinated. You know, despite being optimistic, this virus still remains active. So we ask that you get the vaccination. We also want you to help us in the next couple of weeks. You know, the extension of the mask mandate is vital. We will continue to require masking at Bryan Medical Center for the foreseeable future. I also wanted to share with you some information in regards to the children in the pediatric population. Since December 1st, we've seen 29 pediatric COVID positive patients at Bryan. You know, we continue to be actually a relief valve for Children's and for Boys Town and Nebraska Med for the non-COVID pediatric population. You know, it's great to see organizations work together and talk about how we're going to plan and transfer and take care of patients and how we coordinate that care. You know, there has been some relief in Omaha as well. We're starting to hear some bed availability. That's a good sign. It's trending in the right direction. But we also have felt that as these children have continued to get COVID, it's really affected our workforce, because a lot of these children pass it on to their parents, and those parents are our employees, and they're needing to be off work. Or those parents are needing to stay home with their children. And this is not the time to relax our precautions. So if you have children, please get them vaccinated. You heard Pat talk about the decompression project. That's been very helpful. We've been able to transfer 10 patients that no longer meet acute care requirements, freeing up 10 beds in our facility. So in regards to masking and boosting, we're asking you to continue to do that. It takes care of our citizens. It's going to be the way that we can put this surge behind us in the rearview mirror. I want to share with you a slide that you can see how the masking has really affected what we have traditionally seen from influenza. So if you look, it's always the first quarter of every year where we have the real high hospitalizations. Look at that trend and what has occurred from 19 until today. So it really demonstrates that masking does work. So we would encourage you to continue to do that. If there's no other reason why to mask, it helps the spread of influenza as well as COVID. So again, we implore you to continue to get vaccinated. We ask that you get boosted. We don't want to continue to be overwhelmed in our facilities. And we're getting close to the finish line, folks. And I think continuing to do this for the next few weeks is going to assure that we get there. Thank you.
Thank you both very much for being here today and for the partnership that we've shared with CHI St. Elizabeth and Bryan. I also want to give a heartfelt thank you to our healthcare heroes taking care of all these patients at the hospital. As Dr. Rapp and John mentioned, vaccines remain a powerful tool in preventing severe illness and saving lives, and are critical in getting COVID-19 to a level that is more manageable. Boosters doses help keep people out of the hospital, and you need the booster dose for the best protection. Our local data shows out of the people hospitalized in January with breakthrough COVID-19 infections, more than 90% were eligible for their booster, but hadn't received it yet. If you are eligible for your booster, please get it as soon as possible so you have the benefit of added protection. Overall, more than 60% of people aged 12 and up who are eligible for a booster or third dose have received one, but we want to see that percentage increase. And I want to share a snapshot from the dashboard that shows the percentage of those who have received a booster by age group. As you can see, there is room for improvement in many age categories. Once again, if you're eligible for your booster, don't delay, get your booster dose now. And throughout the month of February, we will continue to work with partners to host convenient walk-in vaccination clinics at several local elementary schools and other locations close to home, so getting a first or second or booster dose of COVID-19 vaccine is easy. Later this afternoon, we're hosting a clinic at Arnold Elementary School from 4 to 6:30 p.m. On Wednesday, we're at UNL City Campus from 9 to 1 and UNL East Campus from 3 to 5. We'll also be at Clinton Elementary School tomorrow from 3:15 to 6 p.m. On Thursday afternoon, we're hosting a clinic at Elliott Elementary School from 3:15 to 6. We also have a clinic at the Health Department this Friday from 9 to 3. All the clinics will offer first and second doses and boosters. Just go to covid19.lincoln.ne.gov to find additional times and locations, or just call us at 402-441-4200. As of today, almost 66% of our entire population is fully vaccinated. And I'd like to turn to testing. The Nebraska Department of Health and Human Services is finalizing the contract for its at-home testing initiative. We anticipate we'll receive around 30,000 test kits for our community once the program launches. We will have more details on distribution as soon as we have test kits in hand and final information from the state. And we're also working on a new resource so Lancaster County residents have the option of reporting the results of their at-home tests to the health department. It will be a simple online form available on the COVID-19 website. All the information will be confidential. And people who report positive results will be directed to helpful information about quarantine and isolation. Sharing this information will help support our understanding of COVID-19, its impact on the community, and home test kit use among residents. We expect to launch this resource by the end of the week. And we continue to see strong signs of improvement in our local situation. In cases and positivity rate, we're on the right track, but it will take a little bit more time before hospitals see a significant impact. Right now, they still really need our help. Again, we'll be extending the DHM for 2 more weeks. Masking up, getting vaccinated, or a booster dose, along with other preventative measures, will help our community move beyond this current surge and to a better place. And with that, I'd be happy to take any questions.
Hi, Pat. It's Matt Overdick from the Journal Star.
Hi, Matt.
Hi. I had a clarification question for you. I'm not sure I heard it right, but I thought Dr. Rapp from CHI Health said they had 24 patients, and John Woodrich said Brian had 84, which is 108. But you said there was 130 patients this week, so I'm just wondering where those numbers come from.
We still have some that are clinically diagnosed and are awaiting test results, but they have the clinical diagnosis, and that can change. You know, Matt, just like they're saying, I can let them talk, but when they're sharing that information, things change from the time we get our data at midnight to the time they come here today. So there can be variation. So we're going to be really excited if they stay at 108.
Okay, thank you.
Sure. Okay.
This is Noel with 1011. Just to double check, when you have, or when the people of Lancaster County have the ability to self-report their results, will that then go into your data and onto the dashboard?
Thanks, Bill. That's a great question. Some of it will and some of it will not. With the eMed, that's what the testing option is the state's going to be providing. There is the opportunity for people that are taking the test, and we'll have more details on this, to actually have a medical professional monitor them when they're doing the test and guide them through FaceTime. And those will be reported directly into the state dashboard and be counted as positive cases or negative tests. And the individual will actually receive a test report. The other tests that people do at home, like when you buy a kit at, I'm going to say Hy-Vee or, Walgreens or CVS, those test results do not get reported into the state dashboard. But we really feel it's important for people to be able to have access to quarantine and isolation information, and for us maybe to be able to monitor and see what's happening. Okay. All right. Well, thank you again for joining us today. Remember to get vaccinated, get your booster, and wear a mask. Thank you.